It's something that's not taught anywhere near enough as it should be in medical school. But every practicing physician quickly realizes that in healthcare, communication is everything. It's the foundation of the doctor-patient relationship and is what your patients will judge you on. Sure, doctors are among the busiest professionals out there and have an incredibly hectic job, but never forget the importance of those few minutes you get to spend with the patient. It's important not just for patient experience, but also for your own satisfaction as a physician. I'm Suneel Dhand, and here are some communication tips for doctors. Before entering the room, always knock. Of course, you are going to enter the room anyway, but knocking just displays a sense of politeness and consideration. When you walk into the room, walk in calmly and confidently, not in a hurry. Extend to shake the hand of your patient. Often the patient will already be extending their hand to greet you. Use a nice firm handshake, although not as firm as you may do during other situations such as a job interview. Smile every so often. Now, a smile, especially at the start of your greeting, may help foster a sense of friendliness and cooperation. However, exercise your own judgment on this. If it's a bad clinical situation, you obviously don't want to walk into the room smiling and beaming, but every so often, a smile during your normal conversation with the patient may be very appropriate. With regards to your greeting, using the first or last name of the patient, again, exercise your own judgment. It may be appropriate for older patients to use the term Mr. or Mrs. and be seen as more polite and proper. Always sit down. Sitting down places you at eye level with the patient and is also more comfortable for you rather than towering over them as they lie in bed. Did you also know that research suggests that when physicians sit down, patients perceive them to be in the room for much longer than when physicians stand up? In fact, the study showed that even though the physicians were in the room for less time when they were sitting down compared to those physicians who stood up, patients still perceived them to be in the room for much longer. Patients also expressed better understanding of their condition and a greater level of satisfaction with their care. Give your patients a chance to speak. Research suggests that physicians interrupt their patient within about 20 seconds of the patient speaking. 20 seconds. Next time you're with a patient, just give them a chance to speak for a little bit longer. Obviously, again, you're very busy and you need to stay focused, but remember the famous saying, if speaking is silver, then listening is gold. Maintain good eye contact. Keep looking at the patient, obviously not freakishly constant staring eye contact. Look away every so often as you would during a normal conversation. You can also utilize other techniques such as using hand gestures to emphasize points and leaning in every so often as you do so. Ask as many open-ended questions as possible. Remember, in medicine there's often more gray than black and white. Patients' histories are stories, not a robotic set of tick boxes. Open-ended questions typically begin with words like what, why, or when, or a statement like, tell me about that abdominal pain. Closed-ended questions, on the other hand, are designed to elicit yes and no answers, such as, do you have abdominal pain? Obviously, asking open-ended questions takes more time, and you're very busy and need to remain time conscious. However, asking open-ended questions has enormous benefits, including fostering more compassion and empathy within your conversation. Avoid using excessive technical jargon. Remember, you are in the bubble of medicine and it's easy to assume that everyone else knows exactly what you are talking about. The reality is that they probably don't. Avoid banding around words like hypotension, tachycardia, hemoglobin without putting some thought into whether the other person really understands what you are talking about. For instance, a phrase like, your troponin is elevated indicating myocardial ischemia should really be, well, one of your heart enzyme blood tests is high, indicating strain on your heart. If necessary, you can go into further explanation afterwards. Imagine you're talking to a family member or friend who knows nothing about medicine. Don't assume anything. I'm always amazed by the number of experienced doctors I see talking to patients and family members who are using technical terms that even I would struggle to understand. Always keep the family in the loop. Often it's more important to talk to the patient's family than the actual patient. This applies especially if it's an elderly patient or a patient who's confused or disoriented. Never move on to that next patient without pondering whether or not the family is in the loop. You can even call the patient's family from the bedside as you are with the patient. It may even save you a page or call later in the day. Always give the patient a chance to ask questions. Make sure they understand everything you've said. Remember, it's their life on the line, so they should have questions. If there's not time there and then, come back later to address them. Try to end your conversation with the patient on a positive note with a statement like, "You'll get through this." Those words of encouragement can mean a lot to the patient. Let them know how they can contact you if they have any other concerns. If you're in the hospital, you may not even be coming back to see them on that day, but never give them the impression that you've just disappeared. So, having talked about all these great things that doctors should do when they're communicating with patients, here are 3 quick things that you should never do. Number 1, keep turning around and looking at your computer while you're talking to the patient. This is highly annoying for the patient and gives the impression that you're distracted. Nothing beats the value of a good face-to-face discussion with your patients for a set amount of time, as we've just talked about. Ideally, review all information before you interact with the patient so that you have that information handy during your discussion. Number 2, making it obvious that you're in a hurry. You probably are in a hurry as a doctor because you have a very hectic job, but avoid any subtle body language cues that give this away, such as talking too fast or gesturing or motioning in the other direction towards the door. Number 3, making it seem like any patient problem is trivial. Now, the reality of medical practice is that patients will frequently bring up issues that seem completely unrelated to the main presenting problem, such as that painful finger. If it's bothering the patient, do address it even briefly, but then you can redirect back to the main problem while reassuring them that the other issue will be addressed in the future. So doctor, never forget that in healthcare, communication is everything. Treasure those few minutes you have with the patient, which they may have been waiting several hours for. Be fully present, engaged, and as good a doctor as you can be. Those moments of personal connection are probably the most meaningful parts of your day and are why you went to medical school in the first place. When you're with the patient, make them the absolute center of your world for those few minutes and show them how devoted you are to their complete health and well-being. Because as Maya Angelou said, people will forget what you said, people will forget what you did, but people will never forget how you made them feel. I hope you've enjoyed this video and found it helpful. Once more, my name is Suneel Dhand, and for more videos, please subscribe.